there's no amount of gut healing, diet changing, sleep. It doesn't matter. You're not going to regrow your thyroid. Now, I know there's going to be people out there that goes, well, yeah, the thyroid gland can yes, it can a little bit. That's why it post-cancer, we want to keep the TSH suppressed so it doesn't regrow tissue. But in general, you're not really going to regrow your thyroid gland. You could stop the destruction. You can put the Hashimoto's into remission, but the destruction has already occurred. The building's already been blown up. So, unless a crew comes in to rebuild that building, it's going to stay in shambles. So you need the hormones to build your body back up again.
Good morning and welcome to the Fusionary Health Podcast. I'm Dr. Shivani Gupta, and this is the podcast dedicating to recalibrating your health every day. My goal is to help you wake up each day energized by addressing root causes and giving you new approaches to preventive health. The more we know about integrative health, the more empowered we are in building the vibrant health we want. Welcome to the Fusionary Health Podcast. I have a special guest for you today, Dr. Amie Hormone. Amie, welcome.
Hi, Dr. Shivani. Thank you so much for having me on.
For sure. So for those of you who don't know Dr. Amie yet, she is the Thyroid Fixer, and she's the host to a top-rated podcast in medicine and alternative health called the Thyroid Fixer. She's the founder of the Institute for Thyroid and Hormone Optimization, an organization with transformational, proven approaches to address thyroid dysfunction and support people in returning to full health. She's also the creator of the Fixer supplement line with their revolutionary proprietary supplements that are changing the lives of many people. And I got the honor of meeting Dr. Amie at a conference recently called CHS. We hit it off. And if you listen to this podcast, you know, as a woman in her 40s, I am obsessed with thyroid health, hormone optimization, perimenopause. Like, what is the toolkit we need in modern day times to have accessible to us as we go through each half decade and decade of our lives and try to manage living healthy lives for ourselves, for our families, in the chaos of modern day life. So, Dr. Amie, I'm excited to have you on today.
Well, I'm excited to be here. And I love that you put women's health at the forefront of your discussions because, if we're not talking about it, who is? And women really need people like yourself out there getting this message out.
Absolutely. And we're living in a time where there's so many conversations coming to the forefront. Conversation on menopause, perimenopause, the fact that as Western medicine was doing all their clinical studies, they were doing it on men and they consider us small men. It's just ridiculous. Like, I get so enraged because I'm like, do we not understand? We're so different. And we need to we just need way more support than what we're getting. And we're kind of crawling in the dark and grasping for solutions and tools. Even I myself am always like, I'm still trying to understand how to optimize this body. And I'm going to amazing functional medicine practitioners. I'm going to the best conferences. I teach the topic. And even I myself am sometimes in the dark about like, what's the next best approach? So Dr. Amie, well, let's kick this off with what is your approach to thyroid health and what are some of the main things that you focus on with your patients?
Absolutely. So first of all, when we're talking about the thyroid, we have to break it down in that 95% of all hypothyroidism, low and slow thyroid function, 95% of that is Hashimoto's. That's the autoimmune form of hypothyroidism. So that's where our bodies are attacking the thyroid gland. Our bodies literally think that the thyroid gland is an invader, a bad guy. And I always talk about autoimmune as picture soldiers. And these soldiers are in your body, but they're not working for you. They're working against you because they're confused. They think that your thyroid gland is a bad guy. So they regularly go out and they beat it up. And I always say to women, listen, if I came over and beat you up every day, you wouldn't function very well. You wouldn't work very well. You wouldn't think very well. Same thing happens with your thyroid. So when it's getting beaten up on a daily basis, it's going to stop producing those valuable life-giving thyroid hormones that we need and that every cell in our body needs. So right there, we have to lay that groundwork that 95% is all of hypothyroidism is Hashimoto's. Now let's look at the numbers of women who are diagnosed versus undiagnosed. So we have around 16 million women walking around with the diagnosed, you have hypothyroidism, you have Hashimoto's, boom. Then we can get into treatment, of course, and how off kilter that is in the conventional world. But of that number, double it, that's the amount of women walking around undiagnosed. Because they're going to their PCP saying, I'm gaining weight. I can't lose. I'm losing my hair. I'm so tired. I can't get through the day. I can't even go to the bathroom every day. I have brain fog. I have memory loss. I think I'm getting early Alzheimer's. What's going on? My skin is dry. I'm prematurely aging. And their doctors say, well, here's an antidepressant and just go ahead and eat less and exercise more. So that's 32 million women walking around going, well, I don't know, maybe I am normal. Maybe it's just me. Maybe I should starve myself. And those are the women, well, they all need help. The 16 million who are diagnosed and probably on the wrong thyroid treatment need help. The 32 million who are undiagnosed definitely need some help. So, this is just, thyroid disease is an epidemic that is almost not talked about enough. It's kind of brushed under the rug. Like, well, okay, yeah, you have a thyroid problem. Here's a little pill. You'll be okay. And it's just not focused on enough. So where do I start? I start by listening to the woman's symptoms. Men and women get hit with Hashimoto. Sorry, guys, I'm not leaving you out. But let's be honest, women get hit harder and they get hit more often. So first of all, we have to listen and ask, how do you feel? And really listen to those symptoms. Secondly, we have to test. We have to test thoroughly, and we have to look at those numbers as they compare to the symptoms and how that person feels.
Absolutely. And I'm so glad you brought it up that way. So 32 million people in the US, I think we have about 350 million people. Last I checked, I'm sure it's maybe a bit higher. That means about 10% of the country is suffering. And when they go to the doctor to get an answer, the doctor's like, you're fine. And this happened to me. This is why I'm so passionate about bringing up the topic. It's funny because I'm in health. Of course, my friends and family don't listen to me, but all sorts of strangers do. So whenever I tell my friends, this is called subclinical thyroid, they're like, yeah, but I went to the doctor. The doctor said I'm fine. So I actually go to doctor's appointments with lots of people around me just to ask the intelligent questions. And I'll never forget, I took one of my sister-in-laws in to an endocrinologist who's very well regarded in the community. And I asked her, I said, okay, you're saying she has Hashimoto's. Okay, but she's telling you she wants to have a baby now. What are the diet and lifestyle changes she should make that will support her while you're starting this medication? Is there any more natural or better medication? They're like, nope, that's the medicine. It's Synthroid or levothyroxine. And obviously giving up gluten or diet doesn't do anything for this. And I was so horrified. I was like, do you read? Like, what are you people doing? There's so much. How do we not acknowledge that food is a part of every autoimmune and inflammatory issue in the body at this time? And that's when I started looking for different doctors, because I knew when people want a solution, they might not always be ready to pay for functional medicine and jump into that next level. And they want to hear it from their traditional MD. So I found one doctor, and he's the first one who said to me, yeah, I find women, even though I prescribe those traditional medications, they're never happy. So I do prescribe Armour thyroid, NP thyroid, because they get a different result. Their symptoms are managed. So what are your thoughts on that? Because I think that undiagnosed piece is so huge. And how can you help a woman understand if she fits in that category?
So first of all, if you're walking around with symptoms, I truly believe that that is a sign and a gift by your body to you to just say, hey, you know what? Something's going on. Why don't we just look a little bit deeper? Because our bodies were so beautifully made. They were not made to walk around fat, frustrated, tired, and constipated. So when you have those symptoms, let's check it out and let's do the check the right way. Let's test what we should be testing so we can get real answers. So first of all, we have to start there. Secondly, and this is just unfortunate when we're dealing with the conventional medicine system. And I know, I mean, you and I talked on my podcast, you come from a long line of medical doctors in your family. I am not anti-Western medicine. We talked about that on my show as well.
Yep.
Neither are you, right? We are not anti-Western medicine. But when I get really peeved is when Western medicine just goes by standard of care.
Right.
So most doctors in med school, they learn that if TSH, which is thyroid stimulating hormone, that's the test you're all going to get. You walk into your doctor's office, you are guaranteed to get TSH tested. However, TSH is a pituitary hormone. It's not a thyroid hormone. So you're going to get that TSH checked. And if it is above the standard reference range, so right now it's a 4.5 cutoff. It used to be higher. We've gotten it down. We really need to get it down a little bit more. But again, conventional medicine, if TSH is above a 4.5, give T4, pat them on the head, wish them luck, send them out the door. That is standard of care. And that's the problem. And just like your story told, you have to be open to giving other medication. So quick story for you. This is years ago. I gave a talk to an integrative wellness physician group.
Mm-hmm.
And I went in because they still were not really tuned in on the thyroid. So we talked, and in my talk, I was talking about all the testing that we need to do. And then I talked about the treatment. And I said, you guys are in the Synthroid box. You're only giving T4. I said, if a patient came in and they complained of depression, you would give them this antidepressant. And if that didn't work, you'd give them another one and you'd stack on a benzo and you'd give them a sleeping pill. But with thyroid medication, you're giving one medication. Why is that? Yeah. And one doc raises his hand and goes, that's all we've learned. So, here we are. And if that's all you learned in med school, then what about continuing education? What about branching out, maybe taking a functional course, right? It doesn't mean that you have to charge money. You can still accept insurance, but maybe you'll be a little bit more open-minded to really help people. Sure. And that's really the bottom line. So when I get asked the question of what thyroid medication do you like the most? My answer is the one that's going to work for you, in the dose that's going to work for you, in the combination that's going to work for you. Because we can give you armor, but maybe that doesn't quite do it. Okay, let's add on some T3 to that armor and change the ratio of what armor is. It's 80% T4 and 20% T3. Some people do really well with that. Some people need more like a 60-40. Some people need more like a 40-60 with more T3 on board. Wow. It's all about that personalization of the thyroid treatment to get that person, that woman well and feeling better and literally moving through life like a rock star, saying, you know what, I'm good. I'm not gaining weight, looking sideways on a brownie. I don't need my 2 p.m. nap. I'm rocking through the day and I'm sleeping well. Oh, and I poop every day. So that's a win to me. And that's really the goal, is to get the woman to that place of living her best life.
Absolutely. And I know that most of us who understand health and wellness, so many of us are into biohacking now, we're into functional medicine. The goal is not to take any chronic medications. That's the goal. And my goal is true prevention, true longevity. I would love to reverse my chronological age. I think I have, because I feel like a 30-year-old all the time in my body. But there are different inflection points that we have with our health. And I do think of that as like half decades, decades. I definitely hit perimenopause and was like, what the F is this? I don't accept. We have to find a new formula. And so I had to keep writing new plans out for myself of like shift exercise, shift gym, shift approach. Okay, that's still high cortisol. Like, it was a lot to shift into, but now I've found my home base with it. And what I was sharing with you before we started was, I've been taking Armour Thyroid for years, and it was so powerful when I started. I was post-kids, couldn't think straight, couldn't remember anything. It felt like I put glasses on in my brain. I had my memory back, my energy back. which to me is worth $1 million. So started feeling fantastic and thus had the energy to go back to the gym and eating clean and bringing the awareness. And now, just in the last few months, my life got so crazy busy. I asked the doctor, I said, can we double it? Can we just increase it the tiniest touch? I'm curious if I'm like mega supported if I do that.
Mhm.
But it almost felt like to me, I was going so fast in my life that to double the medicine like that felt like I was going too fast. Like I felt almost frantic with it. It didn't feel settled and good. And I can usually hold peace. And I wasn't able to feel settled and peaceful. So
Mhm.
I dropped it back down and I'm holding now back the original dose. And I recently had someone on my podcast who said, we really shouldn't take any of those medicines. We should do the work to not take anything. And my approach with health is usually I'm going to support you. I'm going to give you what you need. Like I make a turmeric supplement, I'm going to get you out of pain. And once I've gotten you out of pain and I've reduced that inflammation, now I can tell you, okay, let's do a lifestyle change. Let's do a diet change. Let's move more. We can talk about change, but you kind of have to turn off the fire burning the house down first. So, what
Mhm.
is your philosophy and approach to that?
So, first of all, I'm pretty sure that anyone that says, "Oh, let's just go the long way and look at all the different root causes and let's not use medication." I'm pretty sure that's a guy. Because here's the thing, as we talked about earlier,
Yeah.
as a woman, we have a lot of stuff to do. I don't care if you're a mom or not, businesswoman or not, women are busy. We take on too much and we take on too many people, so we're always doing for this person and doing for that person.
Right.
We need support. And if we're walking around 20 pounds overweight, not loving getting dressed in the morning because everything is tight, counting the hairs that come out of our head in the shower and freaking out over that, seeing our skin age quicker than ever, having brain fog, dragging ourselves through the day just to get through, that is not quality of life and that's not going to work. It's
Yeah.
not going to work for us. It's not going to work for our family. It's not going to work for our businesses. It's not going to work for our husbands, friends, kids, nothing. It's not going to work. We have to think of thyroid, we'll say medication, because it comes in, one of those little prescription bottles that you get at the pharmacy. However, we have to think of it as hormone replacement. We are literally replacing hormones that are no longer being made. So to that person that's, yeah, just go off your thyroid medication, you'll be fine. If that person had a child that had type 1 diabetes and the doctor comes in and goes, your child needs insulin. Insulin's a hormone. Your child needs insulin because their pancreas is no longer producing the right amount of insulin. You wouldn't be like, we're going to find the root cause of that. We're not going to take that medication. The doctor would be like, okay, then your child is going to die
Right.
because without insulin, with type 1 diabetes, you will die.
Yeah.
You're not going to do that. Now, without thyroid medication, you're going to die? No, but you're not going to live a great life.
Right.
And then eventually, all the organ systems that depend on thyroid hormone to turn it on, whether it's our heart, our blood pressure, circulation, muscle contraction, brain function, gut motility, all of those systems have to work a lot harder. And they're like, it's almost like running through mud. Like they're trying to keep up, but they're just sludging through the mud because
Right.
everything is slowed down. So yeah, I mean, it could be argued that if you don't properly treat the thyroid, diseases will come on a lot faster. And that's not good for us either. So I'm a firm believer in thinking of thyroid medication as hormone replacement. We are putting those hormones back into your body that you need, that you absolutely need. Now, to speak to your experience, and we talked about this, but I want to bring it up just for the listeners.
Yeah.
My suggestion would be to split dose. So when I'm working with patients and let's say we're at that place where, hey, you're still experiencing some symptoms. This is the dose that you're on. We can test you too and look at the numbers over here and pair it up. But let's go up in your dose. But since T3 is very fast acting, it peaks at 4 hours and
Mm.
then starts to kind of dissipate in your body. Let's split that dose. So go ahead and take that morning dose the same way as you always have been. And now let's put another dose of Armor NP T3, whatever it is, in the afternoon, because by the afternoon, you're out of T3, you're done. So
Right.
now by the afternoon, your body's kind of like, oh, okay, I'm slowed down again. And it's sludging through the day. Metabolism drops, energy drops, brain function drops in the afternoon. If you put that T3 in the afternoon, now you're not bolus dosing that in the morning where you're like, whoa, that's too much. Holy cow. Now you get to spread it out. And it's like, oh, okay, nice, steady energy, nice, steady metabolism through the day. So it really is, the thyroid is it's a nuanced art. It is not a one size fits all. So you really have to get with that person and go, okay, how are you feeling? Okay, let's try this. Let's do this. And there's always a plan that we can do to get you optimized, to get you to that place where you're like, yes, I love life. I'm rocking every single day. And that's what I want for you.
Absolutely. And I do phenomenal. And then the minute lunchtime ends, we're done. My brain is shut off. I
Mm-hmm.
have lost so much capacity. It's insane. And I
Mm-hmm.
can tell because I'm like, okay, we get to do busy work now. Like
Yep.
it's like the fuel is gone in the car. It's been burned. And I actually feel guilty because I take no other medication other than this one. And I always think to myself, why haven't you done the work yet to win at this? Why is this one still here? So, have you seen people who are on the lowest dose of armor eventually heal the gut and do whatever the work is to get so optimal that they can let it all go? Or is it usually like, look, this is a low dose, it's okay, and it's supporting you, and do the other work anyways? But it's a good solution.
So my answer is it depends. If I have, and I'll go back in my patient vault. I had one patient who was in her 20s, and she was right at the cusp.
Yeah,
Yes, she had gained some weight. She had the weight gain. She had some of the symptoms. But when we looked at her labs, it's like, okay, you're right at the start of Hashimoto's. You're right at the beginning of your thyroid gland getting eaten up and destroyed. So what we can do here is give you some iodine and magnesium and supportive nutrients. Let's go gluten free. Let's do black cumin seed oil because that is amazing at lowering inflammation and antibodies.
totally.
And then let's check you again and let's see if we can keep you off the medication as long as possible. But the flip side of that is, I don't care whether it's a low dose, a high dose, a medium dose. If it's giving you life back, who cares? Because you're replacing the hormones that your body just isn't up to par for producing anyway. So let's take the thyroid gland, and let's say you've had Hashimoto's for a while, and now it's gone from nice and thick and plump and juicy and working to kind of smaller with jagged edges.
Hmm.
And it's only producing half of the amount of T4 and T3 that it used to. There's no amount of gut healing, diet changing, sleep. It doesn't matter. You're not going to regrow your thyroid. Now, I know there's going to be people out there that goes, well, yeah, the thyroid gland can yes, it can a little bit. That's why it post cancer, we want to keep the TSH suppressed so it doesn't regrow tissue. But in general, you're not really going to regrow your thyroid gland. You could stop the destruction. You can put the Hashimoto's into remission, but the
Hmm.
destruction has already occurred. The building's already been blown up.
Hmm.
So, unless a crew comes in to rebuild that building, it's going to stay in shambles. So you need the hormones to build your body back up again.
And then my next question would be, let's say, because I've been on Armour Thyroid now for almost 10 years now that I think about it,
Mhm.
what's the conversion of that as you go into perimenopause and menopause into further hormone replacement therapy? Because
Yeah.
I actually think we're flying so blind. Not only are 32 million, like you said, having undiagnosed thyroid conditions, so just suffering through the 20s and the 30s. Then you hit your 40s and you're like, what in the bejesus? And so I finally got tested because I told my doctors, I was like, I'm certain I'm estrogen dominant. I formed a fibroid and I had to get it operated on. I couldn't reduce it any other way. It was 10
Mhm.
centimeters. And lo and behold, I have zero progesterone. I'm postmenopausal
Mhm.
and I'm low testosterone. So I lift, I do lower body workouts. I naturally try to rebuild it.
Yeah.
So, how do you work with women like that and say, look, now this is a new transition? We're going to have to do some hormone replacement therapy. And guess what? Postmenopause, you might want estrogen. So how do you work with that woman and how do you educate her on, look, you can actually feel phenomenal, all this crap you're suffering, it's a choice. We have options now.
Yes. Oh, such a good question. So first of all, as we move into perimenopause and menopause, that's often a time where women will start to notice additional symptoms. And yes, low hormone symptoms can cross over and overlap with hypothyroid symptoms. But there's also a term that I'm going to give credit to Sarah Gottfried for saying, thyropause.
Hmm.
And she nailed it, because when we go into perimenopause and menopause, when we look at Hashimoto's in general, we know that there's a trigger. There's something that comes along and flips that switch to the on position, right? We have the genetic predisposition for autoimmune. The switch stays in the off position for most of our life. And then something happens, pregnancy, perimenopause, menopause, hormonal shifts, stress, boom. Now it's in the on position. So this is where you'll hear women say, like, well, it was after my second pregnancy that it just all went to hell in a handbasket. Or it was after I hit 42 when I went into perimenopause that everything, down regulated and the weight came on or whatever. So it's those hormonal shifts that start to occur that can turn on Hashimoto. So, okay, now we have to address thyroid, but oh, wait, we have to come over here and address the hormones too.
Yes.
Because just as you said, in perimenopause, we see this steep drop off of progesterone. That's usually the first hormone to go. Right behind progesterone is testosterone. Exactly what you're saying. I mean, this is the classic pattern.
Yeah.
So as you move through those years, let's replace. Okay, let's replace progesterone. Let's replace testosterone. And then when you start to actually move into menopause, boom, let's add in some estradiol. And what I say to these women is hormones give you life. These are in the same category as hormone replacement. We can do that now. We know that the Women's Health Initiative study was wrong. It's incorrect. The authors are coming out saying, oops, we're sorry for those 20 years of misinformation. Turns out hormones are just fine. So we know now that hormones are protective. They protect our brain, they protect our bones, they protect our muscles, they protect our libido, they protect everything. I mean, our breasts, like, they're protective. So that's what I say to women is like, listen, if you want a high quality of life and you want to prevent Alzheimer's and you want to prevent heart disease and osteoporosis, we have to add on the hormones as they decline.
Right. And the thing is, access is hard. Finding the practitioner who will listen is hard. And what's crazy is I have really good access to healthcare. I'm in South Florida. I know thousands of doctors. I work with hundreds of them who recommend my supplements to their patients. So I'm constantly picking the brain of doctors and people. And I have had a hard time getting prescribed because they want me to get a mammogram, they want a pelvic ultrasound, they want all this stuff, and I don't want to do it. I don't want to do everything. I just want what I want. And so it's just me against my every doctor who I've met is not listening to me. And I'm like, listen, you have a baseline mammogram from 2, 3 years ago. I'm not going to do an annual. I'm sorry. You don't
Right.
need that from me. And so I'm stuck. And I'm like, wow, if I'm stuck and I can't just get the answers I need properly. And then I went to a traditional primary care office, and that's where I was like, whoa, you guys think so differently than I now think. We need an entirely new class of practitioners called hormone specialists for women's health who can actually work with us and customize for us, or we're going to continue. And then women are out there just scrounging, begging for solutions, but never feeling like we're at our true optimal. So
Yeah.
how do you work with patients? Are you able to work with women in all 50 states? Like how do people work with you typically?
Yeah. So I made it my mission to be able to do this, because I truly believe in my heart of hearts that hormone replacement and the proper thyroid hormone replacement is vital and should be available to everyone. We shouldn't have to go to our doctors and our OBGYNs and try to beg and
Yeah,
convince. So, number one rule is, if your doctor says no to testing, so if you go to your doctor and just say, hey, these are the tests that I want, and they say no, then it's time to get a new doctor. If you hear that hormones cause cancer, it's time to get a new doctor. It's hard because the conventional system was scared by the Women's Health Initiative
sure.
study that hormones cause cancer, and I could get into the ins and outs of that, but that would take too long as to the why. But that it's been proven wrong. But there's so many conventional doctors that are still under that thought process. So right now we're facing, number one, the conventional system that scares the women. Then we move into, there's hormone clinics popping up like puppy mills on every corner, where it's a one size fits all. Here's some hormones. Good luck. And they're not even testing women, and they're not customizing it. And then we have functional and integrative medicine that is definitely open-minded, a lot more open-minded, but then you have to get in a little bit more granular, like you said, and actually be able to specialize and know what you're doing with thyroid and hormones.
Correct.
Because oftentimes, that functional label is a great marketing tool for doctors in the conventional world to stop billing insurance and start charging. Well, yes. I mean, functional medicine spends a lot of time with you, and it's not covered by insurance, unfortunately, at least not right now. But you also, if you're going to go into that functional world, then you have to treat functionally, and you have to get out of your conventional mindset. So yes, I made it my mission to be able to prescribe in all 50 states, so we can prescribe bioidentical hormones. We do peptides. We do the right thyroid medication in all 50 states and most of Canada, actually.
Nice. Yeah, I mean, this
Yeah.
conversation around split up the dose never happened. No one's mentioned that to me anywhere along the way. It makes total sense though, because when it comes to turmeric, we have a half-life, and I would rather you take a turmeric in the morning and a turmeric in the afternoon and not take both at once. So it makes total logical sense. And then the other piece is the ratios. It didn't occur to me that 40, 60, 80, 20, that customization could be huge. And then now will you speak about the supplementation? Because I think a lot of times you're told, here's your pill, you're good. Obviously, have a good diet, obviously, reduce inflammation, reduce gluten and things like that. Do the typical stuff, go exercise, sleep well, whatever. But if you're not told, hey, did you know that your magnesium, your iodine, and your this is off? And if you're not taking these things, you're not supporting the thyroid, you're not foundationally supporting what you need to, then aren't you always kind of chasing your tail?
Yes. Yeah, absolutely you are. So the thyroid gland makes 4 thyroid hormones, 1, 2, 3, 4. And one is inactive, we'll set it aside. T4 is also inactive. So if you're given Levo, if you're given Synthroid, that is T4. If you're given Armor, that's 80% T4 and 20% T3. T3 is the active thyroid hormone. So what has to occur is T4 needs to convert and become T3 in order to get to your cells, like a lock and key. All of your cells have a receptor site on them for thyroid hormone, but it's for T3. So it has to be in that perfect, just like the key goes into the lock. It has to be the perfect key to actually insert into the lock and turn it. That's T3. T4 cannot do that. So T4 has to convert over and become T3. Now, when we're talking about T2, that is also an active thyroid hormone, but that works at the mitochondrial level. So that's kind of cool in that we have T2 over here that we can come back to if someone is not converting their T4 to T3 properly, meaning, and it can be a variety of reasons. You could be insulin resistant, estrogen dominant. You could have a SNP on your genes that just makes you a non-converter. You could be low in magnesium, iodine, selenium, vitamin D, all of the minerals necessary to support that conversion. So if you're not converting properly, you have to look at your supplemental status. Are you taking iodine? Are you taking magnesium? Are you taking selenium? Are you inflamed? Like that inflammation will block conversion of T4 to T3. And then maybe you do come over here and add in some T2, because that, along with the minerals, along with the iodine, that is going to help with your symptoms. It's not going to have that negative feedback loop on the thyroid gland, where your thyroid is going to look like you're slightly hyper. Maybe your TSH pushes down, your free T3 goes up, and your doctor says, oh my gosh, you're on too much medication, let's pull it. And you're like, wait, no, I'm fine. I'm still tired. I'm still gaining weight. I don't want to reduce my medication. Okay, let's add in some T2, because T2 is going to increase your basal metabolic rate. And it's also going to increase ATP at the mitochondrial level without that negative feedback loop on your thyroid. So there's a variety of different supplements that we can add in. And T2, you don't have to beg your doctor
Nice.
for. If you're on T4 only and you want to change to Armor, you're going to have to beg. You're going to have to convince. You're going to have to give them this podcast, right? But with T2, that's over the counter in supplemental form that anybody can add in to help support those symptoms of fatigue and weight gain and low metabolism.
I have two thoughts. One, is the whole world buying into GLP-1 because we're gaining weight through this journey when really we just didn't support the thyroid needs properly?
That's a great point. Obviously, we're seeing a huge uptick in these GLPs, and I lovingly call them the Beverly Hills soccer mom drug of choice for weight loss because everybody's taking it. I think they're amazing for type 2 diabetics that cannot get control over their weight, their food intake, their insulin, their A1C. 100% game changer. I think in very low doses, the biohackers have figured out, hey, this reduces inflammation and might even help prevent Alzheimer's. It keeps my insulin in check for cancer. However, they're being used and abused, and they're not. You are correct. We're not looking at, and this is where the root cause does come in. We're not looking at the root cause of obesity. A lot of times patients will say, well, what's the root cause of my thyroid problem? I'm like, your thyroid problem is the root cause. Your thyroid problem is the root cause of your weight and your low energy and your hormones going wonky and you not being able to control your insulin, your glucose, because the thyroid is the master gland at the top and it's a dial. And when that dial turns down and you're hypo, low, and slow, it's going to have this downstream effect. So now your insulin is all out of whack. You have high insulin and high glucose no matter what you're eating. You're on a carnivore diet, you have high insulin. And now your sex hormones start to drop and your cortisol is out of whack. So yes, to your point, yes, let's start with the thyroid first.
Rather than just jumping towards the GLP. I have so many people I know who are doing it. And I'm like, you guys, there's always a price. There's always a price in life. Just be aware of that. And I personally can't test weird things on myself because I'm one of those people. I can't even take most medications. I react 10x compared to a normal human. So I just watched this process and I'm like, this is a train wreck, you guys. Look at it.
I did try it on myself. I did. Yeah, I am a human experiment. But so what I found was you do lose muscle and you do lose facial fat and you will get Manjaro face. And yes, my doctor had to put fat back in my face because I became so hollow right here. And this was on a low dose. I mean, I was literally just experimenting and it happened. So yeah, there's a price. There's a price.
And not to mention all the symptoms. Like I've talked to someone who said every symptom you could get, I got all of them. And I was like, oh my God, that's horrible. My next question is you mentioned in there, look, if you're inflamed and you have gut off and you have low D and low vitamin D and you have low all these things, you're gonna suffer with this condition. And I thought to myself, I'm low in vitamin D. We're all inflamed. We all have some level of gut dysbiosis. So aren't we all running around unsupportive of thyroid health and thus creating this issue? Also, our food is lacking in minerals. So really, this is a horrible setup for thyroid conditions. No wonder thyroid is the number one prescribed drug because everything we're doing is counterintuitive towards healthy.
Yeah.
That's crazy.
Yeah, exactly. I know, it's crazy. I was talking with Tom O'Brien and he said it so beautifully. I'm like, bingo. He goes, doesn't everybody pretty much have a thyroid problem these days? I mean, you get the toxins and you got the chemicals and you got I'm like, you know what? I think you're right. I mean, you might have a few select men out there that have great testosterone levels and that protects them against thyroid disease. But if you look at the general population and if you look at just the population of women, it doesn't matter if they're health conscious and you're busting your butt and you're doing all the things, you could still have a thyroid problem because we're battling this world that we're in, this toxic world that we're in. So yes, I would argue that as well, that everyone could use some thyroid support. That doesn't necessarily mean thyroid medication. Maybe it does mean iodine and magnesium and T2 and bringing down inflammation. Use curcumin to bring down that inflammation to give your body a fighting chance at converting that T4 to T3. But yeah, I think we have to look at the thyroid in every case.
And so when
In
it
every
comes to your
case.
supplements, what inspired you to put them together? And then how did you put them together to support the patient? Because I went through your website and I was like, oh, what do these do? I'm so curious.
Yes, yes, and I didn't tell you before the show, but we do have a
Perfect.
coupon code for
Cool.
your audience, so we'll it's Fusion 10, we'll give that at the end. But yeah, so interesting story. I started studying T2 or 3,5-diethyl-L-thymine about 15 years ago. It has over 30 years of research, but I really started diving in about 15 years ago. And this is before we could prescribe to every state. So I was really on a mission to be able to help these women that were stuck on T4. And just I want to give a quick stat for those listeners on T4 only. T4 only works in 2% of the population. And the stat, and this is from A4M, the stat is 2% do well on. So I'm using air quotes here. I even argue, what does do well on mean, right? Are they optimized? Are they living their best life? Or are they just kind of okay and accepting wherever they're at? 2% do well on T4 only. 98%
Wow.
need T4 and T3. So let's just start there. So for all the women that are on T4 only, and we know that that's the standard of care, I needed to find something to help them. So I start diving into this T2. Now, back then it was only in like a bodybuilding supplement. So it was kind of odd to tell women, 45-year-old women to go to this angry supplement name company and buy this angry named supplement, right? I mean, it was bro science. All day long was bro science. So I decided, I did have some patients that did it and I was seeing results and I was using it. I was seeing results and the weight was coming off and they were feeling better, even though they were on T4 only. So fast forward 15 years, I'm like, you know what? It's time. It is time to bring this to the masses. So that's when I dove in and formulated Thyroid Fixer, which is my baby.
Nice.
That's what came out first. Formulated Thyroid Fixer with T2 in it, just to be able to get it out there. Now it's also in Metabolism Fixer. And with Metabolism Fixer, we made it into a drink and we put suppressant in it to take the edge off the appetite. So instead of the GLPs, let's try something natural, right? And let's increase our metabolism at the same time. So that's what really kind of kicked off the Fixer line
So
was my
you can
study of
either
T2.
take Thyroid Fixer or you can take Metabolism Fixer. And then what was Hormone Fixer?
Hormone Fixer is for the low testosterone because that's what I see. All of my entire line is based on the deficiencies that I saw in practice. So that's the other one is low testosterone. And women get told, oh, you're fine, you're normal, your testosterone is good. I have seen women come in with indetectable levels of testosterone. Like it's not even showing up on their labs. And they're being told it's fine. It's all right. You don't need it. It's a man hormone. You're good. We do need it as women. It's our get stuff done hormone. It gives us motivation and strength and drive and libido and protects our muscles. So that's why Hormone Fixer came into play because it naturally supports women's testosterone
It's a big deal.
levels.
I love it. I love everything. I'm coming to you. I want my optimization because I have a funny feeling that percentage of customization between the T3 and T4 needs to shift because I'm always so dialed in that when my brain isn't functioning at 100%, I get really angry. I'm like, you know what? I know how smart I am and I want full access to my memory and brain. How can it be that I know what I know what I've learned, and I can't reach all the file cabinets back in my brain and access what I want? Or when I'm doing public speaking, how come I can only remember like half my talk and the other half I have to like use slides and remember? Or why is it that post lunch my brain shuts off? Why is it that by evening I look at my day in quarters, Q4 of the day, fourth quarter, there's nothing in the tank. Like I'm trying to be a nice human to the people in my house. I'm like kids and husband. Like I just wish I could hide and find a silent. I wish I had a house next to mine so I could run away and get a silent, quiet corner away from all the responsibilities. And that's a shift. So when you catch those shifts, you're like, why do I now feel this way? What has changed? Where am I not supported? And then it's our job to go find that support and fix the puzzle of our health.
Yeah, absolutely. Well, we're going to do that with you though. So we're going to start by split dosing. Then you're going to do that for the next like 4 weeks. And then we're going to retest you. And we're going to test your reverse T3 because you haven't had your thyroid tested in a long time the proper way. So we're going to get all the testing done on you too. So we'll make those changes. We'll get you going again. I get it.
I am so glad that we met. I'm so glad that you focus on this in this way. I think as women, we need people who will give us the options and the support, because what I see is, oh, low testosterone, you have to do pellets. And then half the people are like, don't do pellets. It's just a very confusing world. And so the fact that you've gone yourself and built supplements as founders of supplement companies, and after having met you, like, I'm obsessed with the quality of my line. I'm obsessed with what I built. And so it's so nice to know that you've done that, but for thyroid health, which, as we've discussed, we all need. So thank you for joining me today. Yeah. Before I let you go, will you share where everyone can find you and that discount code?
Yeah, absolutely. So you can find me all over social at Dr. Amie Hormone, and then the Thyroid Fixer podcast that Dr. Shivani was a guest on as well are on all podcast platforms. My website is dramiehormone.com. And on there, you can connect to the store. You can also go directly to the store at betterlifedoctor.com. Use the code FUSION10, FUSION10. Fusion10, that's going to save you 10%.
Awesome. Well, thank you so much for joining today. You're awesome. I'm so glad you're the thyroid fixer, because now you can fix the thyroid of all my friends and family. I won't be running around with them going to doctors, banging my head against the wall. So thank you for doing what you're doing. Thank you, everyone, today for listening to the Fusionary Health Podcast. Like and share this episode. We as women must share this information with each other, support each other, and get the word out that there are different approaches to build our health and build the vibrant health that we all crave. So thank you guys for joining us today, and we'll see you next week. Thanks for joining me for this episode.